Hey there, I'm Dr. Brittany Lamb. I'm an emergency medicine physician, and today I want to talk to you about a topic I think is really going to help you when you're advocating and trying to learn and plan for your person living with dementia. So, I'm going to talk about palliative care and hospice. In the next few minutes, I'm going to explain why considering these services and learning about them ahead of time can make a big difference for you and your person living with dementia. So if you've been confused about the difference between palliative care and hospice, you would not be alone. It is something that I find a lot of people being confused over, even physicians, even other doctors I work with. So the big difference I want you to understand between palliative care and hospice is that hospice is truly meant for the last 6 months of a person's life. It is meant to have care that is focused on providing that person with comfort and protecting their quality of life as they move towards end of life. Palliative care is different. So palliative care is really about making sure that a person receives the type of care that they would want while they're living with a disease that we know is very likely going to impact their day-to-day life and their quality of life. In both of these services, you actually work with a team of people to support you, the person who's living with the disease, or if you're in the situation where you're advocating for a person living with dementia, to help support you and your person living with dementia. If someone's receiving services under the care of a palliative care team, they can still receive care that is focused on prolonging their life and keeping them alive. So I think a lot of times people feel that palliative care is for the end of life, and that's not true. Palliative care is to support a person while they're living with a chronic illness that we know is going to impact their day-to-day. People can still have chemotherapy, they can still go to the ICU and have aggressive medical care that's focused on prolonging their life. Whereas hospice, the person's goals of care have changed. People have to meet criteria to be cared for under a hospice service, and a physician has to say that it would not be surprising that they passed away within the next 6 months. Okay, so they have to be towards end of life. And people receiving hospice care really should not want to have their life prolonged artificially by medical care. Hospice care is for the end of life. Now, that being said, let's jump into some misconceptions and myths that I hear about hospice and palliative care. I hear oftentimes is that hospice is meant just for the last few days of a person's life. And that's not true. It's meant for the last 6 months of a person's life, the end of a person's life. Now, there are exceptions with this. I have taken care of plenty of patients in the emergency department who no longer qualify for hospice because they're actually doing better. So it is true that palliative care and hospice services can sometimes actually lengthen people's lives because the team is providing more care and oftentimes removing medications, and sometimes a big part of this. So sometimes just taking back and stripping away and only doing what is necessary for the person, providing them a whole team-based care actually does prolong life. So another big myth that I see and people misunderstanding is feeling like hospice care is not providing care. And so because we're focused on symptom management and protecting a person's levels of comfort and their quality of life, it can oftentimes feel like we're not doing what we would normally do in the case of an emergency, like coming to the hospital or having procedures or surgeries or having intensive treatments and things that are focused on prolonging life. But that doesn't mean that the person's not receiving care. So they are receiving symptom management and help protect their quality of life wherever they're living. Something else that I think people get confused about is that palliative care and hospice can follow a person wherever they're living. So if a person's inside of a hospital, they can be started on palliative care or hospice services, and those can be transitioned to where the person is living after they leave the hospital. I will say that it is a little bit harder in some parts of the United States to find outpatient, so outside of the hospital, palliative care services, and that's something that you really want to research early. And that brings me to my next point. It is very important to consider looking into palliative care and hospice before you really feel like you need them, okay? Palliative care is where I would start if your person's goal of care is to continue to have their life prolonged. Every person living with dementia would benefit from having access to a palliative care team. That's my medical opinion. And then when the person living with dementia would no longer want their life prolonged artificially, would want to be able to pass away naturally, who would really want their care focused purely on comfort, who wouldn't want to be coming to the hospital anymore, and is moving towards end of life in their last 6 months of life. That's when we would want to start considering hospice and asking for a hospice evaluation. It's important to know what you have access to in your area and to start thinking about these things ahead of time, because what I find most often in the emergency department is as we're advocating for a person who's living with a chronic illness, like a disease causing dementia, when we watch them kind of slowly get a little bit worse, worse and their quality of life get worse over time, it can become normalized to us. And so we kind of can forget to step back and take a look at the big picture and realize, wait a minute, I think my person's goal of care would change. It's really important to have these conversations about what living means to us, what quality of life means to us, and to just know what services you have in your area. Now, if you have any other questions about hospice versus palliative care, this is a very big topic, hard to talk about in such a short amount of time, please leave them in the comment section wherever you're watching this video. And if you want to connect with me, I do recommend that you sign up to receive my emails. You can go to my website. It's blammd.com/email. I'll be able to share with you links to my blogs, videos that I create, trainings that I put on, and more information about how I work with clients as well. So I hope that you feel a little bit less confused about what the difference is between palliative care and hospice, understand some of the things that people get hung up on about this, and why it's so important to consider it early.